Tuberculosis, the bacteria that thrives on inequality. Tuberculosis is once again the leading cause of infectious deaths in our global population, after 3 years of being surpassed by COVID-19, according to the new report put out by the World Health Organization on the 29th of October this year. It is listed in the Guinness Book of World Records as the world's oldest contagious disease, and not surprisingly, its impact on our species can be seen throughout our history in a myriad of ways. However, its impact today is known to be disproportionately focused on the poorest among us. The disease is caused by a bacteria called Mycobacterium tuberculosis that is spread when those who develop it cough or sneeze it into the air, making infectious aerosols airborne. More than 10 million people continue to fall ill with TB every year, and the number has been rising since 2021. It is highly contagious in its active disease state, allowing one person with tuberculosis to infect 10 to 15 people. It's estimated that about a quarter of the world's population has been infected, but it is during the first 2 years after the infection that people are most likely to develop the disease. Those who face risk factors such as malnutrition, diabetes, or HIV/AIDS are much more likely to go on to develop active TB, and without treatment, the death rate is close to 50%. For most of humanity's existence, tuberculosis affected people from every walk of life, rich and poor alike. But today, when we have curative treatment available, the disease disproportionately impacts low and middle-income countries, while both causing and thriving on poverty. As author and TB activist John Green has pointed out, TB is both a form and expression of injustice. It has come to be seen as a disease of poverty, an illness that walks the trails of injustice and inequity that we blazed for it. How we have understood tuberculosis through the centuries has impacted not only how patients lived and died, but also who lived and died, and that remains the case today. Ultimately, the reality is that we have allowed a disease that has been curable since the 1950s to be the #1 cause of infectious disease deaths in the world. All the member states of the United Nations and the World Health Organization have set a goal to end the global TB epidemic by 2030. But it will require urgent action and a cooperative effort if we are going to make real progress toward that target. Tuberculosis impacts low and middle-income countries more heavily than those with high incomes, with countries in Africa and Southeast Asia disproportionately affected. Yet, even within these countries, there are specific populations that are known to be the most vulnerable.
Vulnerable populations are those with a high risk for tuberculosis disease and whose disadvantaged or marginalized socioeconomic position limits their access to the health system. It has been found that no matter what country a person is in, experiencing houselessness with no permanent home of one's own, whether it is chronic or temporary, makes one vulnerable to TB. Those living in slums or informal, socially economically challenged settlements with limited potable water or no water at all, or in areas with recent urbanization and overcrowding, are also vulnerable populations. Others at risk of TB are incarcerated people, whether detained in prisons, immigration detention centers, drug rehab, or forced labor camps, and those who use drugs or attend treatment clinics that are medication-assisted. Studies have also found that those who self-identify as indigenous people, as well as those who live in nomadic communities, face higher TB risks. And, due to the nature of their work environment, miners actively working in both formal and informal mining sites are vulnerable. Other findings show asylum seekers, refugees, undocumented immigrants, and also internally displaced people are further high-risk populations. As may be expected, tuberculosis is dangerous for those living with a positive HIV status, but it is actually a leading cause of death for this population. Also, commercial sex workers, men who have intercourse with men, and those who are transgender are more vulnerable than the general public to developing active TB disease. Findings show that the burden of tuberculosis is higher among all of these populations, so they would benefit from special screenings and preventative interventions. The world needs to keep in mind that vulnerability sits at the nexus of socioeconomic positions, access to health systems, and risk of tuberculosis disease, leading to inequitable tuberculosis outcomes. By its very nature, tuberculosis disproportionately impacts our vulnerable populations. Since the majority of TB disease cases occur in low and middle-income countries, the reality of the cost of treatment also plays into the reasons that poverty and inequality affect its spread. Low-income countries in particular need the support of the global community if we are going to meet the UN's end TB targets, and eliminating TB as a global public health problem will be impossible without increased funding from domestic and international sources. Those who fall into these vulnerable groups are not only more likely to face higher tuberculosis risk, but also poorer health outcomes due to later diagnosis and poor treatment adherence related to lack of access to care. Aside from these vulnerabilities, there are a wide variety of risk factors and health determinants that impact the spread of tuberculosis. Studies have found that while women develop TB disease faster after exposure, men's risk of developing it is significantly higher. This is likely related to differences in both biology as well as those related to social structure and societal systems, particularly in relation to the fact that men tend to do more manual labor as well as smoking and drinking. Genetic factors and age also create risk for TB disease, with age actually creating a linear increase of risk over time, possibly related to increased opportunity for TB exposures, declines in immune system function, and increases in other risk factors. There are risk factors specifically related to immune system status that have an impact on TB disease as well. People with HIV infection are about 30 times more likely to develop active TB disease, and studies have found that this population will have a higher TB incidence than the general public in any given area. It is worth noting, though, that deaths from TB and those with HIV/AIDS are officially classified as deaths caused by HIV/AIDS in the International Classification of Diseases. For this reason, the World Health Organization separates the data between those who have TB and are HIV negative from those who are living with HIV and have a TB co-infection. Diabetes has also shown to have a clear relationship with tuberculosis, with diabetics experiencing a risk of TB 3 times higher than the general population, and the risk being directly related to the increase in blood glucose levels. Diabetes can impair the host immune system, leading to damage to the innate and adaptive immune responses that normally restrain the proliferation of M. tuberculosis, which leads to TB infection. Socioeconomic status is related to many risk factors, but one interesting risk factor found to be closely correlated with TB was literacy rates. In a study done at the beginning of 2024, using data from 2000 to 2021, literacy rates emerged as a factor with a substantial effect on tuberculosis risk compared to other risk factors. In fact, in the study of data from 209 countries done out of Lingen University, it was found that literacy rate of a population consistently emerges as one of the leading risk factors across all countries and regions. Other risk factors include malnutrition, due to the lack of micronutrients and macronutrients that cause the immune system to function poorly and lose its ability to destroy M. tuberculosis. Alcoholism, which also weakens the immune system. Approximately 10% of active TB cases can be attributed to alcohol. And immune system reduction is also a problem for patients with silicosis, which makes them vulnerable to infection with TB as well. In fact, in China, about 10 to 30% of patients with the first stages of silicosis have TB. The rates for the second stage and third stage silicosis are 22 to 30% and 50 to 90% respectively. Of course, health determinants for tuberculosis are varied and often influence each other in different ways among different populations, so the world must continue to research ways to prevent and treat it, to tailor them to different groups in order to be the most effective. There are 30 high-burden countries in the world where 87% of the tuberculosis cases are found, and yet only 5 countries make up 56% of global cases. India with 26%, Indonesia with 10%, China with 6.8%, the Philippines with 6.8%, and Pakistan with 6.3%. The global TB incidence rate of new cases per 100,000 population per year is estimated to have increased by 4.6% between 2020 and 2023, which is likely at least partially related to the disruption in services that was caused by COVID-19. More than half of the people estimated to have developed drug-resistant or multi-drug resistant tuberculosis are in 5 countries in 2024: India, Egypt with 27%, the Russian Federation with 7.4%, Indonesia 7.4%, China 7.3%, and the Philippines with 7.2%. However, of these countries, the one with the highest proportion of these infections compared to drug-susceptible cases was found in the Russian Federation. The highest disease burden globally continues to be found in adult men, with an estimated 6 million new cases in 2023, which is about 55% of the estimated total, and the next 33% of that total, estimated about 3.6 million cases, was adult women. Adults are counted as those 15 years of age or older. The final 12% of the estimated total, at about 1.3 million cases globally, are those of children 0 to 14 years old. Tuberculosis requires a global public health response. The only current vaccine in use, the Bacille Calmette Guerin, was invented more than a century ago, and its low efficacy after early childhood is such that despite vaccinating millions of people a year, the disease continues to cause over 1 million deaths. It is vital that we create a new vaccine. There are currently 6 new vaccines in trials. The development of antibiotics in the early part of the last century finally led to making TB a curable chronic illness. However, the development of a new vaccine would have a big impact on the fight against tuberculosis in low and middle-income countries. Aside from vaccines, controlling TB spread requires both local and international levels of public health interventions. New infections can be prevented by teaching TB patients cough etiquette, ensuring good ventilation indoors, and isolating those with TB. Since 1994, the World Health Organization has been promoting direct observed treatment, which means a trained observer watches patients take their medications every day. This has been a vital tool in the fight against TB, since completing the months-long courses of medications is critical for successful treatment and is important for drug-resistant forms of TB as well. Countries need to have ways to support diagnosis and treatment, including a way to report cases for tracking and a consistent supply chain for TB medications. From a global economic position, the cost of treatment requires international support, since the brunt of the need falls on the countries with the least financial resources. Unfortunately, the promised funding has not been met. From a medical viewpoint, the increase in drug-resistant TB is a serious growing public health problem. Antimicrobial resistance is when a pathogen evolves to no longer be susceptible to an antibiotic. If a TB strain is considered multi-drug resistant, that means neither rifampicin or isoniazid can kill it, 2 standard treatments. Extensively drug-resistant TB cannot be treated with either of those, plus fluoroquinolones and at least 1 injectionable medication. There are a few strains known to be totally drug-resistant and incurable with current antibiotics. From a sociological perspective, the impact on societies and families from the social stigma can affect multiple areas of life and can be devastating on family relationships and even children's education. The economic burden on patients can be disastrous, especially for those living in low-income countries and those fighting drug-resistant TB infections. About 50% face total costs during diagnosis and treatment that are catastrophic. When we remember that the World Health Organization's End TB strategy target for a patient's expense for TB treatment is 0, then we can grasp just how far we have to go to reach it. If there are no unforeseen changes, then the challenges related to social stigma will remain a serious struggle for patients in the coming decade. Aside from the sociological impacts noted earlier, families are known to reject patients entirely and even kick them out of the house in some cases. Unfortunately, climate change is creating ever greater challenges for everyone living in the impoverished areas around our globe. Findings have shown that tuberculosis incidence is related to climate variability, including temperature, wind, and precipitation, having both long and short-term effects on TB and its spread. A distinct pattern was shown between the incidence of TB, with troughs between November and December and peaks between March and May. It is likely that seasonal variation may be impacted by climate change, population movements, and other factors. Challenges for the poor related to accessing diagnosis and treatment remain, despite some improvement after the declines that happened during the COVID-19 pandemic. But if the End TB strategy targets of the World Health Organization are going to be met, everyone must be promptly diagnosed and treated. Challenges related to diagnosis and treatment are particularly concerning when considering the problem of global multi-drug resistant TB and how it is estimated to contribute to up to a third of TB deaths. While ending tuberculosis seems to be a distant goal at this point, there are at least some positive gains being made after the setbacks during the COVID-19 pandemic. By agreeing together to work toward the Sustainable Development Goals and the End TB strategy, all the UN member nations and the World Health Organization have committed to ending the global scourge of TB. These commitments, made at the 2023 high-level UN meeting on TB, must be met in order to meet this goal and defeat the disease that has been killing humans for millennia. Together, we can win this fight for everyone.